Hi guys, Dr. Lovett, Lovett Family Chiropractic and Wellness Center. In this video, I'm talking about migraines. Most people don't realize it, but about 85% of all headaches start in the neck, not in the head. So that's why it's always important to take a careful evaluation of the neck when we're looking at patients with headaches and specifically migraines. So I want to show you what normal x-rays look like for someone, and then what someone with migraines, what their x-rays look like. So this, I'm going to show you here, this is a normal cervical spine. You can see there's a bit of a curve going on, kind of like a C. You can see the bones are nice and flat in the front, which is what we want. And most likely this person probably doesn't have any pain, doesn't have any headaches. Okay, we can't always tell from an x-ray, but based on what I'm seeing here, there's probably a good chance that their head and neck feel pretty good. And then when we look at this other person, this person actually has migraines a couple times a week. And you can see the drastic difference between the x-rays. Okay, so you can see how their neck is very straight. It's going forward quite a bit. You can see how the bones are changing. See how like this one up here is very, very flat. You can see down towards the bottom, they get very concave. Also, basically what's happening is because of the instability, there's bone spurs that are forming, which is never good. The body is literally trying to stabilize itself. I've also added these arrows in those disc spaces where they're getting thinner. So there's quite a bit of decay and degeneration happening in the neck, which is usually going to accompany decreased function in the nerves. And because this person's neck is going forward so much, think of it kind of like holding a bowling ball. It's kind of heavy, but you can do it. And then you hold it out in front and it's a lot harder to do. And that just has to do with physics, okay? This puts a lot more stress on the spine compared to that C curve that we saw a minute ago, where it's evenly distributed and the spine can move properly. Right now, there's so much work being done here at the top. You can see all of, literally this second bone is tilting downward. And so all of the curve is having to happen at the very, very top. That puts a lot of stress on the upper part of the neck, which can trigger up into the neck and cause things like headaches and migraines. So if this is something that you're struggling with, it's something that we see all the time, and feel free to reach out. We're always here to help.